Pathology. It is a sequence of changes occurring in the disc which led to protrusion or extrusion of NP through a rent in the AF. Degeneration, prolapse, extrusion, sequestration. These changes consist of the following. First, nucleus degeneration. Degenerative changes occur in the disc before displacement of the nuclear material. These changes are softening of the nucleus and its fragmentation, weakening and disintegration of the posterior part of the annulus fibrosis. The second one is nucleus displacement. In the nucleus is under positive pressure at all the times when annulus become weak, either because a small area of its entire thickness has been disintegrated spontaneously or because of the injury. The nucleus tends to bile through the defect. This is known as disc protrusion. This tendency is greatly increased if the nucleus is degenerated and fragmented. Finally, the nucleus comes out of the annulus and under the post longitudinal ligament, though it has not lost contact between with parent disc. This is called as disc extrusion. Once the disc is extruded, it cannot go back and PLL is not strong enough to prevent the nucleus protruding further, so the extruded disc may lose its contact with parent disc. The sequestrated disc may come to lie behind the PLL or may become free fragment in the canal. Now we can see the difference in the structures in the disc. First of normal disc, and this is the degenerated disc. Nucleus pulposus, annulus fibrous, and normal disc, degenerated disc. Borders normal disc, nucleus pulposus, and herniated disc. The third one is stage of fibrosis. In this stage of repair, the begins along the side of the degeneration. The residual nucleus pulposus becomes flattened, fibrosed, and finally undergoes calcification. At the same time, new bone formation occurs at the point where the PLL has been stripped from the vertebral body and spur formation occurs. Now we can see also normal anatomy and disc degenerations, disc bulge, disc herniation. Disc bulge deterioration of the annulus fibrosis allows the nucleus pulposus to push out beyond the boundary of the disc. Disc herniations, complete tear of the annulus allows the nucleus pulposus to push out and put pressure on the spinal cord and nerve root. Symptoms of PIVD: lower back, lumbar herniated disc symptoms, severe low back pain, pain radiating to the buttocks, legs and feet. Walking can be painful or difficult, pain made worse with the coughing, straining or laughing, muscle spasm, tingling or numbness in legs or feet, muscles weakness or atrophy in the later stage, loss of bladder or bowel control in case of Coda equina syndrome. Some people do not have symptoms of PIVD. Research studies where routine back scans have been done on a large numbers of people have shown that some people have a PIVD without any symptoms. It is thought that symptoms mainly occurs if the prolapse causes pressure or irritation of the nerve. This does not happen in all cases. Some pulposus may be small or occurs away from the nerves and causes minor or no symptoms.